an overview of the latest policy guidelines around reopening, and I suppose to kind of help people consider what plans to put in place and share the expertise. Like, you guys have done amazing work over the last year. People have shown strength and strength again. So it'll be amazing in the breakout rooms to hear those different kind of experiences and advice that people can give. I know just even in some of the centres that I've talked to, the work has been unbelievable. People, go above and beyond, and the things that they think of is just amazing. So yeah, it'll be great to hear about that. In terms of the webinar last week on the Med Fund, thank you so much for all of the suggestions, queries and inputs that everybody gave in the breakout rooms. I've logged all of those questions, and I'm making a frequently asked questions page or resource. So that will be added to our AONTAS news piece that's there on the website. And my colleagues have been updating all of the different dates for the deadlines across the different ETBs as well. So please do check that space to get any information that you need. I will say, in terms of this presentation, I've included a lot of information, and that's pulled from different policy guidelines. I won't read through every single thing, but the aim of it is that it'll be a resource for you. So when you're developing or redeveloping the policy that you already have in place, or if you're, meeting with your board of management or pulling together a team meeting, at least you'll have something there you can refer to. And I think hopefully I've pulled out all the key points that you need. So hopefully it'll save you some time. That's the real aim here. So also the other thing before I forget to say is that last year, as you know, we had a webinar similar to this. And then we also had a health and safety expert who gave an input at the CEN meeting. So those videos are both available on the AONTAS YouTube channel. And then also the news piece from last year, which gave some really good information too. So, don't forget to check AONTAS website for information on loads of different available resources that are there. I'm going to try and time myself so that I don't spend too long. And Barry, please feel free, or Katie, to come in and tell me to stop talking if I go over 20 minutes. Anyway, okay. So just in this presentation, I'll just give you an overview of the policy guidelines, some of the key messages that people hopefully will come away with today. Have a look at the updated framework from the department, some practical guidance, and then the discussion questions for our breakout rooms. So this is the key policy frameworks, I suppose, that has been pulled from. So there's the COVID-19 National Protocol for Employers and Workers, and that has a lot of key information around health and safety plans. And then there's a safe return plan for further and higher education and research, and that includes community education. And I suppose that's a key message to say during this, that when FED is referred to by any of the department documents, it includes community education. So if you are a community education group and you're unsure where you fit within all of that, they mean to include community ed within the broader FED space. There's also practical guidance for further and higher ed on the website there that gives a really nice explanation of different kind of procedures around health and safety practice as well. So that's all available on the department's website. But as I say, I've included kind of the key points in this presentation, so you'll have it afterwards. And then in terms of how these frameworks have evolved and how AONTAS and yourselves feed into that, as you know, there's the test steering group. So that takes place directly with the minister. So that's happening again this Friday. Neva's on leave at the moment, so I'll be attending that meeting. So please let me know if there's anything specific that you want me to bring there. But I'd imagine after that meeting that there will be a new update on the guidelines, potentially taking into consideration the amount of people that are now vaccinated. So hopefully that will mean that some things may be a little bit more flexible than they were. There's also the mitigating educational, the MED group that we had that was chaired by AONTAS, and we had a range of members as well involved in that. That was amazing to have that FET and community ed perspective involved. And there's also the connectivity working group, which I sit on. So in that space, we've been giving updates on any of our members' needs or issues around Wi-Fi and technology. And then there was the student learner wellbeing and engagement working group. So across these range of different groups, we've had different members like Longford Women's Link, the Women's Community Project in Mullingar, SHEP, and others who've all been involved in making sure that the community ed sector is heard and that their perspectives are shared. And then there has been FET representation from FET representatives directly on the ground, and ETBI as well, and SOLAS. So it's been For one part, at least one benefit of the pandemic, and I hate to say that to dismiss any of the horrible things that have happened, but one benefit is that the tertiary education sector has really worked closely together, and I think probably for the first time on this level, which is great. So I think the inclusion of FET and community ed in that space will continue going forward. Higher and further education, training and research are essential activities. So that means that going forward, your service can remain open. I remember at the start of the pandemic, obviously there was a lot of confusion around that, but that was one of the key points that members put forward that they felt, which obviously we agreed with, that FET and community ed should be open and it should be identified as an essential service. So as part of our advocacy work, we argued that case and it was recognised by the department and health and safety guidelines as an essential service. So when you're opening up this coming September, you will be able to open and teach directly face-to-face. The framework is there and that will continue to evolve. Kind of some of the new language that's there that I just wanted to highlight is the term discretionary framework. So that's one of the new pieces that was released in the last few months. And there's also the new vigilance plan. So that's just kind of like an updated overview of the specifics in terms of being vigilant, addressing COVID-19 and health and safety regulations. It's just the language, I suppose, that they're using. And I just want to help in terms of, if you hear these phrases and terms, that you at least know what they're referring to and people don't get worried and think, do I need to go off and read this new thing? Because all the information is pulled from those pieces. And providers should retain some scope for online teaching. So I think that's an important thing to say as well. So even though it is face-to-face teaching, you don't have to deliver all of your classes face-to-face, and you can choose yourself what type of blended approach you want to use. So that should also then cater for learners who maybe prefer learning in a blended approach. And then also those who maybe don't have access to Wi-Fi, or maybe people who need to come in face-to-face because it supports them better, that they would be prioritized as coming in. But once you can follow the health and safety guidelines, you can bring groups in to teach. The following will take place on site from September. So this is just a list of activities that are allowed to happen face-to-face, and that includes workshops, smaller lectures, and teaching face-to-face in general. The others won't apply as much, I don't think, for our members here today. This is the COVID-19 adaptation framework. So basically this framework just outlines a plan for the structure, guidance and support for further and higher ed. And each institution or centre should develop their own guidelines as well. So I know there is the frameworks that are there, but you actually do have the authority in your own right, of course, as a provider, to develop your own guidelines and to plan for the year going ahead in terms of what the needs of your centre is, and for what your local community needs are. And I think that's really important to say. In terms of preparation, institutions should facilitate and support the vaccination program for students, learners and staff. They should promote symptom awareness and tracking and self-management of their own health by students, learners and staff, and support pathways for symptomatic students, learners and staff to PCR testing, and engage strongly with local and national public health advice and guidance. And there will be no requirement for testing or vaccination to attend education or college, but both will be promoted. And that's a point as well, which we clarified this morning with the department, because in the guidelines, it's actually a little bit unclear because it talks about antigen testing, but the department said very strictly that no learners or staff will be asked if they've been vaccinated, and they will not be excluded from coming into their place of work or their place of study for not being vaccinated or be asked to be tested. So just please make sure for your own HR practice as well that you don't ask staff or learners on either of those points. And you can continue to make adaptations during the year as well. And I think that's an important point. So if you decide that you're going to roll out your coming term in a phased basis, that's perfectly fine. It's up to you to decide to do that. And I'd suggest linking in with your staff team and then also your board of management, develop a framework and a plan for yourselves. And then if you have specific things that you'd kind of like to sign off by another authority or group or get information, you can link in with your local ETB as well. This is something that I just thought that I'd include in the presentation. The Tertiary Education Steering Group have been working together, and they're kind of following a group of 6 key principles. And this is something that maybe if you're developing your own plan that you can include that. So that's prioritizing the immediate health and safety needs of learners, students and staff, and the health and safety of the broader community, prioritising learners' interests, recognising the importance of maintaining and continuity in, I think that should have E in front of that, educational services and research activity, ensuring the integrity and quality of solutions, ensuring that at a minimum disadvantage is not exacerbated by the crisis and actions taken in response to it, and sharing best practice solutions and leveraging unity. So it's really important that people have that baseline for when you're developing your own policies, that, you know, you remember what's the purpose of this, why are we working together and moving forward in this direction. As I said, blended learning is still something that is, I suppose, encouraged actually, and obviously allowed. I think it's one of those things that we've realized it's really important for some learners that they have the opportunity to be able to engage in blended learning, and especially for certain groups, it actually makes things a lot easier. So for example, people with maybe have additional needs, and maybe people who have lone parents with children or other parents with children or other caring responsibilities, it's been a lot easier for them to engage in education from the safety of their own home or not have to pay for childcare. So there is a number of different concerns and issues that can connect with blended learning, but for the most part, if it's something that your centre is able to continue to do because it suits the needs of your learners, please do continue to do that. But as I say, it is at the discretion of your own centre. There hasn't been a department guideline released on it yet, but it's something that they're working on, and they're trying to gather a stronger evidence base to make sure that the policy is informed. And institutions and providers can continue to make some adaptations throughout the year. As I said, you can do that as a phase-by-phase basis. So this is the pact that is also included in the guidelines. And as I said, there's the discretionary framework that's in operation for 21-22. And then as the tertiary education sector have been working closely together, they have decided on making a pact to mean that everybody stands together and makes sure that they're all implementing similar guidelines, health and safety, and they're all committed to the work going forward. And obviously, as I said, there are those unique points where you might tailor something to suit your centre or your institution, but at least they have this commitment together. So that's careful and safe opening up on site, promoting public health, dealing with outbreaks, new vigilance scheme, ongoing managing and monitoring, and regular transparent communications. And I think even the communications, as we all know, has been a big challenge, because for a lot of learners, for some, they weren't getting a huge amount of information. And in other centres, or in other institutions, I know that this was a point brought up by some of the universities. They were getting so many emails from different departments and different services, all well-meaning, but it was so much information coming in that it was overwhelming as well. So it's something to think about. How can you communicate with the learners and based on their need and what information is a priority? But I think hopefully for our groups that wouldn't have been as much a concern. And I know people were literally ringing learners and meeting with them face to face where they could. In terms of the practical guidance, I know people probably already have a lot of this information already. And as I said, it will be there. That's in the health and safety video on our YouTube page, and also on the news piece from last time. So you're probably all experts in this already, but I thought I'd go through some of the points. It's building on the practice and policy work from last year, conducting ongoing risk assessments, making the use of your autonomy and adaptability to meet the needs of learners in line with your COVID-19 response plan. And as I said, linking in with your board and your local ETB. Physical distancing at the moment, and this is something that we thought might change, but it's still down as 2 meters. And I know that's really a challenge for centres that are smaller. But at the moment, that is what's there. As I say, it might change now that more people are vaccinated after the meeting tomorrow or maybe later in the year. Any non-essential or unnecessary traffic onto a higher education or further education training campus should be avoided. So when you're thinking about planning classes or planning ahead, try and maybe, have different start times and end times, or don't have sessions or workshops with too many people, if possible. Educational trips and fieldwork, also where there's an overnight accommodation aspect and where physical distancing can be maintained, must be undertaken, but will require individual risk assessments on a case-by-case basis by institutions, and it will be necessary to keep a record of attendance and close contact groups. So as you can see from that, again, it is down to the institution to make those final decisions. So there's a guidance framework, but you and your centre and your team of staff are the people who will make the final decisions once it's in line with health and safety regulations. The other things as well, so say for example, like graduations are recommended not to take place, but if you do want to have graduations, you might consider holding small group graduations and make sure that there's 2 meter physical distancing requirements in place there, and maybe have it, you know, on like an Easter break or a midterm break, so that there isn't as many learners around and you're lowering any possible interaction there that's unnecessary. Face masks are still asked to be worn, but specifically if there is a case where you can have social distancing and you have, say for example, your windows open and the room is ventilated and the class is under 2 hours, a learner doesn't necessarily have to wear a face mask, but it is recommended. And especially where there is situations where learners will be passing each other in the hallways or sitting closely together, or if a staff member is coming closer to the learners, it's best to ask them to wear masks. In addition, face coverings are not suitable for all individuals. So for example, if someone has special needs or maybe they have breathing issues, the recommendation is there, but they also understand the fact that this isn't suitable for everybody. So they might make sure that the staff are aware of this and that you have information posters displayed, that staff have undertaken training, and also that students understand the specific guidelines that are in place and that they follow all of the other guidelines if they're not wearing a mask. So for example, making sure to wash their hands and avoid touching their face, and sneezing etiquette and things like that. And then in specific instances where close proximity to others cannot be avoided, and as I said, like the small groups, face shields might also be something that's worn. So also in this situation, if it is a case where there is a lot of learners in a group and maybe something that's going to be on for over 2 hours, you might consider wearing a face mask and a shield over that, or where there's proximity less than 1 meter. I hope everybody's still with me. I know this is a lot of text. I'm sorry. We have about a few more minutes to go. That's it. The ventilation. So this still stands the same as last year, to try and keep the windows open to keep fresh air. The protocol has found that air conditioning is generally not considered as contributing significantly to the spread of COVID-19, but keep the windows open, as I said. Hand washing. So that's obviously something that's really important. Make sure that there is adequate hand washing facilities, and also hand wash stations placed around your centre. And if it's a larger centre, you'd need multiple stations. So everybody should have access to hand sanitizer and hand washing facilities. In terms of pedestrian flow, actions that could be put in place is staggering the time of lectures, separating and clearly marking entrances and exits, deploying a one-way traffic system as far as feasible. So it would be interesting in the breakout rooms to hear who's done this and whether they thought it worked well, and what they'd recommend others to do. Separating traffic going up and down the stairs if possible, avoiding bottlenecks in foyers, considering tape or other floor markings of 2 meters at entrance and in foyers, and multiple hand sanitizers at the entrance and exit or other appropriate locations, and good signposting. In terms of class length, as I said, so this is similar to last year in that they're hoping you are permitted to have classes for longer than 2 hours, but they recommend trying to keep it under 2 hours, because this has, it's less likely that someone will catch COVID-19 scenarios under that. And if it is a case where someone, in terms of risk assessments, who spent a cumulative period of more than 2 hours during a 24-hour period in an enclosed space with that person would so be considered a close contact and would be required to self-isolate for 14 days. Sorry, that was the point I was trying to get back at. So to reduce the risk of someone having to self-isolate and being identified as a close contact, if you keep your classes for under 2 hours in that 24-hour period, that can help. But I know that's not always possible. And there's no requirement, as I said, to limit the time spent per day or per week. However, staff and students should adhere to the public health guidelines while on site. Temperature checks. So actually, this was something that I found interesting, because I thought temperature checks were still in place and still recommended. But it's advised now that the temperature checking is ineffective and it does not form part of the public health advice in Ireland at this time. And I think we all probably know that yet if you're going into a restaurant or anything, they are checking temperatures, and they're also allowed to ask you if you're vaccinated. So I know a lot of the advice is differing across the sector and across the public provision of services, but that's what's in place at the moment. So you can still obviously check temperatures if you want to, but it's not recommended any longer. And it also suggests that this might create unnecessary bottlenecks or congregations of staff. Employees considered high risk or living with individuals considered high risk should also be considered within your own policy and looking at the return to work policy. So that link and information is all available there, but it's something that you should consider, because obviously you have to protect your learners, but you have to protect your staff as well. And nobody should be forced to be in an environment where they're unsafe. So it's really important that everybody's protected in line with that. I think everybody will have had a lead worker representative from last year, but the protocol requires that each workplace should appoint at least one lead worker representative to work with the employer to prevent the spread of COVID-19 in the workplace. And then isolation spaces. So the protocol advises that employees presenting with symptoms of COVID-19 while at work should be isolated, and that there's a requirement for the provision of a space to isolate in advance of leaving the premises. And you may need more depending on the size of your campus or centre. And then cleaning, general cleaning protocols. This was quite long detailed as well, but I think most people probably know that from before about cleaning twice a day. And then also that your fire marshals and people in charge of first aid are also aware of the health and safety protocols that are in place. Institutions should be cognizant of the requirement to comply with existing health and safety regulations. Yeah, so I have that there as well. As I say, a lot of this is just me throwing this information in so you can refer back to it when you need it. So I'm sorry for the burdening of text today. And then there's the cleaning twice per day as well. What's really helpful is on the department's website, they refer to this, which is an EU platform, European Centre for Disease Prevention and Control. So that comes underneath the Commission. And that website is connected to, and they also have, as you can see there in the right-hand corner, there is it's too small for me to read now, which isn't very helpful, but there is a protocol there that is helpful for staff to read, and that will give you information and advice on disease control as well. Now, after absolutely waffling the ears off you for the last 20 minutes, I apologize. We will go into breakout rooms now. And I think this is the most valuable part of today, is being able to share your experience with each other. I know that groups have done amazing things, so we're all eager to learn as well. And then if you have any questions or concerns, please obviously let us know, and we'll track them and go back to you and link in with the department too. So the questions are, what worked well for you last year? Can you share best practice examples of health and safety measures, hybrid or blended learning, models of learning? What are your plans for reopening this year? What has been the biggest challenge? Do you have concerns? And is there anything AONTAS or others can do to help you reopening? I'm stop sharing. Great. Thanks so much, everyone. You should have your breakout room pop up, and we'll see you back here in 15 minutes.
The vaccination issue and considerations for the safety of learners and tutors with that lack of knowledge of anyone who's vaccinated, and we're considering how to meet the needs of those learning online and those in the classroom. The group is reflecting just on last year, and there was a bit of a mix, with some providers maybe not getting as much done last year, reducing their capacity and suspending courses and provision, whereas other ones went 100% online. And we talked a little bit about a few other examples, like risk assessments at the minute, like with groups going through the risk assessments, but how it's all up in the air with, kind of waiting around to see if restrictions will potentially change within the start of the academic year. And yeah, especially around the social distancing, that the 2 metre and the 1 metre rule. And oh yes, just a couple of very specific examples from Annette there at the end. Annette was describing how venues were an issue, with venues reluctant to ensure, or venues reluctant to participate, and then the challenge of insurance as well. Just as in age action, they're dealing with an aging population and just unable to get the same cover that they had previously. So I think that those are some of the main points we brought up.
But everybody kind of made do with this situation, and some people used phones as a means of communication. So rather than having their groups using tablets, phones seemed to work for them. And I suppose, like other groups talked about, not being able to recruit new learners into their classes because it just wasn't possible given the spatial and kind of other requirements. Things that people are kind of happy with is there's no, this time around and going into the new year, there's the new term, there's no temperature checks. That's a huge thing, because that would have put a lot of pressure on groups. Other groups mentioned like front loading their IT now so that they're ahead of the game and stuff like that. One of the things that did come up was one of our, Brigitte was mentioning that like she was listening to a radio program with Simon Harris and somebody else from I think the ETB, and there's a lot of mixed messaging around 1 meter, 2 meter, can canteens open and so forth. And just kind of another kind of challenge, I suppose, was dealing with assessments and skills demonstrations and stuff like that, and it just takes longer to get through all of that stuff. And then Mary was saying from the Doug that there's a lot of anxiety as well, like even though people feel better placed this time around, there's been a lot of learning, but there is anxiety, and that's kind of the main points. And obviously I'll feed these back into Barry.
So around the biggest challenges and concerns, one issue that came up was space, and specifically the social distancing guidelines. Particularly organisations that have smaller training rooms, there is less space for learners because of the social distancing guidelines, and that might mean that tutors have to do multiple classes. So if you have 1/3 your normal capacity, you'll have to deliver the same material 3 times, which has a huge impact on staff workload, increasing it. And another issue around the space is that the new social distancing guidelines means that some of the provision will have to continue online. And of course, there's the ongoing issue that learners, there are learners with needs that just can't be served by online learning. So those learners are missing out. Again, around challenges and concerns, kind of expectations around delivering hybrid learning and how difficult that can be, the feeling of having to be everything to everyone. You're trying to serve the needs of learners who do want to return to on-site learning, trying to serve the needs of learners who don't want to do that for whatever reason, and trying to all those expectations is very difficult for staff. And then finally, it was just reiterated, what a great job tutors have done supporting their learners through the pandemic, and how so many tutors have gone absolutely above and beyond, providing support to learners, providing extra support outside of normal hours to learners who really struggled with online learning. And I know from the work that we've done in the research team that learners really appreciated that, and it made all the difference for a lot of learners in terms of being able to continue with their courses during the pandemic. So those were the main points from our group.
The common theme that emerged in our group was how people could meet safely, again, how to deal with, minimize the risk. And especially while it is understandable that the employers cannot ask whether employees have been vaccinated or not, there's also another aspect that maybe learners want to know if their tutors have been vaccinated or not. So there was concern, or kind of the expression, or the dilemma that was pointed out in the group. So that's the main point from our group.
Thank you so much for everyone for coming today. It's great to see you. I hope that I didn't bore you senseless with that very long policy presentation. It's hard to make that sort of stuff riveting, but it's important. And we'll send out those slides, so hopefully you can use that as a reference for your work that's ongoing. And do get in touch if there's anything at all that you want to ask for clarification on, or that we might be able to get information for you, or find some sort of support. And I think the messages, if I could speak properly, that I would say to go home with today is to follow those cleaning regulations and health and safety guidelines from before, to build on the policy that you already have, to remember that your own institution or centre has the authority to decide what is best for your centre in terms of a phased approach or blended learning, or if there's some slight amendments that you need to make. And to use the funding that's now available to buy all the health and safety equipment that you need, any signage or anything else, software packages or anything that you need for blended learning. We know it's not enough, and we know that it's not sustainable funding for the sector, which is obviously what we need, but hopefully at least is a support for the moment. Have a lovely afternoon, and hopefully we'll see you all again very soon. Have a good one.